Hello, I'm Dr. Ghaffari. I am one of the early pioneers developing IPL technology, and I work extensively with people such as Dr. Patrick Bitter Sr. in developing photofacials, as well as a number of applications that was for skin treatments, including pigmented lesions, vascular lesions, hair removal, and skin rejuvenations. I'm the president of Venus Medical Solutions, and as I look back about 20 years ago, late in 1990s, I did the video training discussing the scientific and clinical applications of IPL technology that I think you will find interesting. I encourage you to see them, and there are different segments that talk about different aspects of the technology, and I hope you would enjoy them. To that skin. Once you're doing that, let's say for face, for photofacial, you typically try to do it in areas that you do not have any lesions. And as you move into areas that have lesions, the lesions become a target. The same thing is going on with hair removal. You want to do a calibration of the skin just outside the area that the hair follicles are located. And obviously, if you're doing a facial hair, you want to do the calibration on the face. If you're doing bikini line or legs, you want to do the calibration in that area. Once you establish what energy level is the maximum that you're comfortable delivering to the skin that does not have the lesions in it, once you move into areas that have lesions in them, then the lesion become your target. With this technique, we have shown that there are a number of areas that typical lasers that haven't been able to do the treatments of hair, we have been able to successfully treat those areas. At this point, what I want to talk about is the ability to do different skin types and different types of hair that is located at different distances and depth inside the skin. Skin basically is comprised of epidermis and dermis, and we have hair follicles in certain areas are deeper. You may get them as much as 5 millimeter into skin, as little as 1.5 millimeter. The goal of hair removal is to cause damage to the follicles, so that the follicles as a whole basically is damaged, and the normal processing of tissue replace these follicles with normal healthy cells. But if you choose the components of light, as we have described this is a 550, this is 1100. The components of light that fit into 800 plus, they are targeting deeper layers of hair. The component of light that are closer to 515 or 590, they are targeting more of superficial layers. And when you have a broad spectrum, you are targeting both the superficial and deep layers. But here's what happens to the device as you dial in different crystals. And here, what I want to do is to show you that the effective filter is when you choose the different filters. This is an epilite based system, so it gives you 590 through 695. What that means is that as you choose different types of crystals, you need to make sure that you have the same crystal type in the handpiece. The system is not designed to automatically detect that. So make sure you dial in the same crystal and you would put in the crystal of your target in the handpiece. The 590 is what we use when you're doing 560 because these systems did not allow 560. However, when you dial in 590 versus 695, the system adjusts itself such that it will deliver the same fluence that you're dialing in. Now let me elaborate on that a little bit more. Let's assume that I have dialed in a 695, so I'm basically putting out the energy passed on this range. So obviously if the same setting was there, I'm missing all these components, so I would get much less energy delivered here. But if I keep the same energy level, what the system will do is it will increase the total energy such that the total energy coming past through the crystal gives me the energy that I've dialed in. So effectively it bumps up the energy level, so you're getting that kind of energy coming out of the head. And this is assuming that the remaining energy is filtered out and you don't have to worry about it. However, if you do put in a 560 crystal, you're passing so much more energy, which causes burning and all kinds of side effects. So you got to keep that in mind, that as you are dialing in different types of crystals, the system increases and decreases energy. As you go down towards 695, the system has to increase the total energy it puts out with the flash lamp, assuming that you're filtering out the components below 695. And as I move towards 590, the system decreases the energy, assuming that you are basically putting more of the spectrum out, so that the total fluence stays the same. And the bar graph that you're seeing up here is an indication of how much energy this is putting out into flash lamp. So if you're putting this, you see the bar graph is dropping down to here at the same fluence. And if I were to go to 695, you see the bar graph is moving up. That means it's putting out more energy to the flash lamp, assuming that you're filtering out the unwanted components of light. Another factor of keeping this bar graph into consideration is that as you go down to less number of pulses, instead of 3 to 2, you see how much more energy it has to put out. That means the system had to compensate because of only 2 pulses having this much fluence. It had to put so much more energy into flash lamp that within only 2 pulses it gave you as much energy as the previous 3 pulses. So you keep that in mind, that if you see the bar graph being totally too low or way too high, maybe there's something in the setting that's not correct. You need to adjust that. The settings that change the energy delivered, this is a number of pulses. See that how it changes the total energy? And the pulse durations, as you're increasing it, it goes down because it has more time to deliver the energy. And as you're decreasing it, it will go up. And all of this is because my fluence is left intact and I'm not changing that. Now if I reduce the fluence, it also, as you see, it reduces the bar graph, meaning that you're putting less energy into the flash lamp. Now having said all of this, now back to our protocols for the head removal. We need to dial in the correct number depending on what type of a skin we have to deal with, and we have to make sure the filter type is correct. On filter type 755, even though we do not have 755 in the screen, by keeping in mind that the difference between a 695 and 755 is approximately 15%. If you dial in 695 and you take that into consideration that you're putting out 15% less energy than what the display is saying, you need to increase the energy to compensate for that. And once you're doing the skin calibration, you got to keep that in mind, that the higher the filter type you're using, the skin calibration is happening erythema is happening at the deeper layers. So it's become a little bit harder to see it. But skin calibration will give you an idea how much energy that skin is capable of accepting, and you'll be able to get good results. On different things that you have to take into consideration is fine hair. You can use that across the board. And as you go to fine hair, remember that we are wanting to have better absorption to hair, and as a result, we're recommending filter type that's less than when it's coarse hair. The components of light that are in 800 and above are going deeper, but they're also absorbed by hair less. The components of light in the 560 to 590 range are absorbed by hair the most, but at the same time they're absorbed by epidermis as well. So given that you are able to control epidermal temperature effectively, now you're able to deliver and get good results using 590 and even 560 in some cases, and get very good successful hair removal done on certain areas such as upper lip, which the hair follicles are very close to the surface. So the typical range that we want to optimize is not only being able to heat up the follicles, but also try to create or peak temperatures near the follicles. What that means is that if I give the energy to the skin, the typical heat has this kind of behavior, and cooling will bring it down, so you create a peak temperature somewhere inside the skin. Now this is for components using a 560, and as you go to towards 695 or 755, it becomes more like this. So the peak temperature is moving down from this location. The importance of this comes in when you're trying to treat lighter kind of hair. In blonde hairs, we've seen as much as 40-50% efficacy compared to a dark hair, if you're able to create peak temperatures at the follicular area rather than just randomly any place. And at that point, your goal is not only to heat up the hair follicles, but the vessels that are feeding the follicles will also become your another target that you're able to effectively go after. The different settings that we have, each session, just like a photofacial series, we have session number 1 through 5, vertical and irradiation versus horizontal irradiation, again to make sure that we're not missing areas in hair. And the settings, you would dial it in and do the skin calibration and do the treatments. So we've developed a system to make it very easy for anyone to be able to get as good a results as other people who've been doing it for years. Now on the practical side, when we talk about doing treatments on the photofacial series, we want to go with some systemized system that will always get you back where you were, and you would not randomly jump around, such that if you have to stop session for any reason, when you get back to it, you can just pick up where you were and continue with that. And what we have developed is a circle for face. When we're doing the treatments, basically we start one side. It could be usually the right side. And as you're doing treatments, you do here, from near the ears, all the way down to near the chin. You do the other side, you do the chin, and then you do the forehead. So you complete the circle here. If you need to do neck and chest, then you do neck and chest, and you come back to do nose and upper lip. Upper lip is the most sensitive area, and you always want to do that last. And nose also is sensitive, but the reason we want to do this last is patients would basically feel the rubber band snapping against their skin, but they get used to it by the time you get to upper lip area, so they're not going to be as objective about the upper lips and as compared to a case that you start out with the upper lips. Now the methodology that we used, I use this crystal just for simplicity, so you can see what's going on. When we're doing the vertical, typically we do series here, and here, but as we get closer to the lip line, we turn. Again, we do here and here, then we do the chin, and as we're doing the forehead, depending on how much size you have to work with, if you can start like this, you start like this and you have to turn at some point, and so on. Now, if we have too short of the forehead, we may have to do a horizontal on that. When we get to the neck, it will be impossible for you to fit the head inside here and do a vertical. So you're sort of forced into doing the neck in a horizontal method. But what you would do in order to overlap the different sessions, in one session you do the center and the two sides, and this next session you divide it in half, you do half and then the other half. So you sort of overlap the two areas. On the neck, when we're doing the vertical, it is holding it vertically. We do this treatments, and when you're doing horizontal, you do this methodology. Okay, and when we are done with the circle and the neck and chest, on the nose we put gel all around here, and make sure you have plenty of gel on here in the creases. Then we do one pulse from the bridge of the nose here, one pulse here, make sure you have enough gel on all the curve. Then you turn to 45 degrees here on the bridge, 45 here, and you go further down here, and the last pulse is right on the crease that you usually have blood vessels here, and you do two pulses, one like this and one like that. Then you do another one here, another one here. So by putting the two pulses here, you basically duplicate pulses for these vessels that are prominent around this area. And on the upper lip, just like the neck, we do center and the side, or the next time around we do a side and further out to make sure that you're covering. Things that you have to be careful about is bras. You need to start, if you're doing horizontal, start from the edge and move away from critical components such as bras and the lip line. It's always better to start at the lip line and move away from it than it is to start from the top and realize that you have to overlap greatly not to get to the lip line. The sessions through 5. The 5 sessions start from being less aggressive and moves it all the way towards the thermal relaxation time of the hair. It's usually a good idea to plan out your session in advance, knowing what kind of crystal you're going to work with, what kind of settings you have, and let this first session be the gentle session and build up over time. The hair removal is usually recommended to have 4 to 5 sessions because of the 3 different cycles of hair, and typically it's anywhere from 6 to 8 weeks between the sessions, depending on how fast the hair is growing in different areas of the body. The areas that you're going to see improvement if you have been doing it with other modalities is for upper lip, which by the use of 590 or 615 or 645 with the proper energy levels, you're going to see good results. You can jump to session number 5 if you feel that you want to be aggressive to start with. However, make sure your skin calibration is done right, and make sure that everything we've talked about is taken into consideration. So as a recap on hair removal, you can get very good results if you're giving proper energy levels. Typical energy levels is in the 35 to 38 joules per square centimeter. And what you also see is you may be able to put as much as 45, even in some cases 50 joules per square centimeter to see erythema develop, and be able to deliver that kind of energy allows you to get very successful results. Certain cases, if you're not giving enough energy, it's less than 35, in the order of 32 or below, you may see an enhancement in hair growth. That is because of the fact that you're basically helping tissue develop a better circulation, and the hair growth seems to be enhanced. In those cases, make sure that if you're doing hair removal, you're pushing the energy up in the right range to be able to get good results. On skin types, you will see that when the skin type is type 3 or 4, European type, and certain types of hair, such as red hair or blonde hair, by providing enough energy, you will see that you're able to pull out the hair out of a socket without much resistance. That is usually an indication that the treatment is successful. Hair removal is pretty straightforward. As far as discomfort, most patients should tolerate any discomfort without any topicals. And patients usually feel a little bit of stinging more during the first session when you're doing treatments of the follicles. And as the number of hair is reduced with treatments, they feel less and less discomfort. So they need to be warned about the first session being a little bit more uncomfortable than remaining sessions. For photofacials, we recommend not using topicals if the patient can easily tolerate the discomfort. But in the case that you do have patients that are just super sensitive, can use topicals. In any case, whether you're using topical or not, when you use this system with the cooling, the patient's comfort is reduced, or discomfort is reduced dramatically. On the average discomfort of 7 out of 10, 10 being the very, very uncomfortable discomfort, with using gel, when you use a cooling system, it drops down to 3 out of 10. So there's a dramatic improvement in how much discomfort patient experiences when you're using a cooling system. I think you have the best tools to be able to do best photofacials, which call it photofacial elite, and best hair removal, in some cases better than most lasers out there in the industry right now. You'll be able to use this with the same machine and be able to fine-tune it for a specific type of skin and hair and the type of condition they have. So I want to congratulate you for purchasing this system, and I think you will find that the combination of the cooling and the IPL technology with the sufficient power that we're delivering will enable you to do the kinds of treatments that are unmatched by any other technology. Thank you.